The pandemic has been a wake-up call for all of us to pay more attention to our mental health. And in China, it's helped to highlight something that used to be shrouded in shame and secrecy.
有咨询服务需要的广大医护工作者、师生和人民群众都可以拨打4007。
It's normalized seeking help.
One of the biggest things that impacts mental health treatment, especially access to treatment, is the level of stigma.
During the Mao era, mental illness was written off as a weakness or delusion, an imaginary affliction for people who just needed to toughen up. That stigma persists today, but things are changing.
And in the past, China has this idiom, 家丑不外扬. You don't want to tell other people what's bad happening in the family, and I can definitely see that start to shift.
At the peak of China's coronavirus outbreak, more than a third of respondents in a nationwide survey reported psychological distress. Mental health became a hot topic, and a wave of new counselling and support services followed. There were art exhibitions, TV shows,
你好，我是中国心理学会的心理咨询师，请您相信我有足够的专业能力可以帮到你。
even musical theatre has helped bring conversations about mental health out into the open. But it's not a totally new phenomenon. Investments in mental health research and services have led to a massive reduction in suicide. Only a few decades ago, China had one of the world's highest suicide rates, particularly among young rural women. But now it's lower than Australia's.
The public system is quite well run and quite well funded, but it does present certain challenges specifically with mental health, in that the mental health encounters are usually quite brief.
Yet while mental health care is improving, China is still understaffed for professional help. There are only 2.2 psychiatrists per 100,000 people. Australia has more than 6 times that number. Drugs and hospital stays are arguably overused, while quality psychotherapy is harder to access.
I think right now China has a lot more different variety of services available in public sector, the NGO sector, and funded by the government. The downside of it with all these experiments is that sometimes it can be very confusing, chaotic.
Part of that confusion comes from the rapid growth of the sector and disreputable services exploiting anxiety for profit.
发床，那个咨询师让我躺在沙发床上，讲了一些同性恋是病啊。
In 2014, Yanzi successfully sued a conversion therapy clinic that attempted to change his sexuality by giving him electric shocks.
我觉得中国需要出台特别的禁止扭转治疗的法律。
Yanzi says these services increasingly target young trans people who are coerced into treatment by their parents. There are even cases when LGBTIQ people have been forcibly detained in psych wards by their relatives.
然后又有中国有非常多的医生，在医院里面或者是私人诊所里面，心理咨询机构，他们会说，因为为了赚钱，他们会说，同性恋就是可以改变的，是应该要改变的，而且他可以做，所以。
While the mental health law of 2012 bans involuntary treatment unless someone is a danger to themselves or others, there continue to be reports of people being committed for all sorts of non-medical reasons, from political dissent to personal grievances.
反对习近平专制暴政。
Like Dong Yaoqiong, or Ink Girl, who spent more than a year in a psychiatric facility after defacing a poster of Xi Jinping. But a medical lens has limits too.
Ways that we have perhaps promulgated a very Western idea of what it means to be ill, especially mentally ill. I do hope that Chinese classification systems will move, and not only Chinese ones, but ones around the world, will move more toward indigenous understandings of what it means to experience difficulty.
China has some unique challenges when it comes to mental health. Rapid change, intense pressure to conform to social expectations, and rising inequality and isolation can all contribute to stress.
Chinese folks traditionally have conceptualized difficulties in a much more integrated way, in which we do not separate the emotional from the physical, or from the spiritual, or from the social, or the community.
Maybe that's another lesson from these troubling times. You can't isolate your mind from your body, or from the world around you. The outside gets in somehow.